The U.S. Surgeon General has called for a new warning concerning alcohol. This is tied to links to cancer.
The warning would appear alongside the current warnings on bottles concerning the risk of drinking and driving and drinking while pregnant. Congress would still have to approve the change, but this morning our 9 News medical expert Dr. Payal Kolhi joins us to talk more about this. Thanks for coming in.
Good morning.
So why now after all this time?
Well, it's long overdue in my opinion. It should have happened a long time ago, but there's a few reasons for why now. First, we're realizing most Americans don't realize that alcohol causes cancer. In fact, it's the third kind of leading preventable cause of death. 100,000 Americans a year get cancer from it. 20,000 die from cancer from the alcohol. Second, we know that labels change people's behavior. So if you put a label on something, it kind of slaps you in the face every time you indulge in that activity, and it does really lead to behavioral change. And third, there's kind of emerging research that shows and dispels the myth alcohol is good for you. A glass of red wine a day is good for you. So we really want to send the message, no amount of alcohol is good for you, and in fact it's harmful.
So how does alcohol cause cancer, and specifically what kind of cancers do we see linked to alcohol?
Yeah, so there's two main mechanisms. One is when we drink alcohol, it breaks down into something called acetaldehyde, which is directly carcinogenic. So if you think about where that might cause cancer, it's all the places that alcohol contacts: your mouth, your esophagus, your stomach, your liver, your pancreas, and your colorectal. And in women, it also causes breast cancer. But there's also a second mechanism, and that's hormonal changes. And women are especially sensitive to this, but hormonal changes induced by alcohol can also lead to cancer growth factors.
You kind of touched on this, but specifically women need to be concerned about consuming alcohol.
Much more. So we're seeing, deaths related to alcohol in women actually have really increased in 2023. And there's two reasons for this also. One is women are smaller in size, right? So a glass of wine in a woman actually induces more damage than that same glass of wine in a man. But the second is actually women break down alcohol a little bit differently. And there's differences between races too, how we metabolize alcohol. So certain ethnicities may be more sensitive to the effects of alcohol.
How long do you see something to take effect after, having so many drinks? I'm thinking about back in 2020 when we saw a lot more alcohol consumption because everybody was stuck at home during the pandemic.
You'll see immediate effects. Some of those hormonal effects happen right away, and then you'll see kind of more chronic long-term effects because alcohol is causing damage to our DNA. So the way that we get cancer is the cells try to repair themselves whenever they accumulate damage, and alcohol doesn't just cause damage, it also prevents the ability of the cells to repair themselves. So you can see acute effects from alcohol in our mood, in our energy level, in our weight, in our blood pressure, electrical problems in the heart, but then you also see these long-term cancer-causing effects.
We just have a few more seconds, but I have a question. So if they're going to put a label on this, which they just might, why wouldn't you put it on candy or, anything that has red dye 40? Should labels be on anything that can cause cancer?
I think they should, because I think people don't know. We consume cosmetics and food and products and environmental things that we don't realize are harming us in this way. And we really need to start turning the spotlight on things. So I think labels work, and I'm really, really excited about it.
It's a good conversation, definitely have. Dr. Kolhi, we appreciate your insight as always.
Thank you. And you can find all of Dr. Kolhi's appearances on 9news.com/Dr. Kolhi.